Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Mr. Smithers?
That's right, Toby Smithers.
Now, I think you've been having some stomach problems.
Yes, that's right, for some time actually.
Okay, I've got some notes here, but perhaps you can tell me in your own words about those problems. About any treatment you've been having, or anything else you can remember that seems relevant.
Okay. It all started about 9 months ago with a stomach upset.
Okay.
I thought I'd caught the vomiting bug that was going round.
Yes.
Basically, I just couldn't keep anything down. No diarrhea or anything, but it was pretty bad.
Right.
Anyway, it cleared up in a couple of days, and I went back to eating normally. The thing was, though, from that time on, whenever I had a meal, lunch or dinner, I'd feel incredibly sleepy almost before I'd finished, and for about half an hour afterwards. I didn't feel tired as such, not in the sense of fatigue. It's just that I could hardly keep my eyes open.
I see. Were you in any pain?
No, none at all. The only other symptom was that I was getting very thirsty, especially at night, so I was drinking a lot.
Right.
So I went to see the doctor, expecting some simple explanation, but she said my symptoms were quite unusual. Well, not the drinking. She explained that the stomach upset had left me dehydrated.
Yes, that's right.
But it didn't explain my other main symptom.
And the dehydration passed?
Yeah, that was just a temporary thing. Then she asked me if I'd ever had stomach cancer, which was a bit worrying.
But you haven't?
No. But then she explained that there's a condition that has similar symptoms to those I had. She didn't think I actually had that condition, because it generally affects people who've had stomach surgery, and I hadn't. It's called gastric dumping syndrome.
Oh, yes.
Anyway, what she suggested as, like an interim measure, was following the treatment plan for that syndrome, even though I probably hadn't got it. So I had to keep drinking because I needed to keep my fluid levels up.
Yes.
But not whilst I was eating. So in other words, I had to separate the 2 activities by about half an hour. Then as for the meals themselves, she suggested an eating regime that she called little and often. So, no major blowouts and no skipping meals either.
Sure. Did that help?
Yeah, it did, but it was only meant to help me in the short term. Because meanwhile, I had various tests. I gave a urine sample, went for a blood test, neither of which showed up anything untoward. So I just hoped it'd clear up of its own accord.
But it didn't.
Well, no. The regime worked all right, but as soon as I went back to eating and drinking normally, the symptoms would come back.
Okay.
So the doctor referred me for an endoscopy. I saw a gastroenterologist for that. He'd looked at my other test results and examined me and everything.
Sure.
And of course, once the results of that came back, they showed that I'd got Helicobacter pylori.
I see.
So I went on the course of treatment, the 3 drugs for 2 weeks, 2 different antibiotics and an antacid. That's the combination which gets rid of it.
Yes.
After that, I went back for a breath test and that was all clear. So I thought that'd be the end of it and I'd be back to normal.
But you're not.
Well, I've given it a couple of months, but the symptoms are the same.
Okay.
If I stick to the eating regime, I'm okay. When I come off it, I'm back to square one. So I'm thinking, sure, the stomach problem that the gastroenterologist found has been dealt with, but that wasn't what was causing the original problem.
And how's this affecting your everyday life?
I can live with it. Obviously, it would be different if I was driving for a living or operating machinery, but I'm a teacher, so it's okay. But to cut a long story short, I asked for a second opinion. And so here I am.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Hello, doctor. Good morning.
Good morning. What's your problem?
Well, doctor, I have itchy red rash on my feet.
Okay, what's your age?
21, doctor.
Tell me if you have developed any associating symptoms or signs.
It is tingling persistently, doctor.
Since how long have you had this problem?
For the past 4 weeks.
Exactly on which part of your foot you are getting this problem?
Right great toe, right second toe, right third toe, and right fourth toe. Often the onset of itching starts after removing sweaty socks.
Do you drink or smoke?
I do not smoke, but I do drink.
Have you had any diseases in the past?
Well, I had chicken pox and frequent ear infections.
You had any surgeries as well?
I have surgical ear tubes.
Do you take any medications?
No, doctor.
Are you allergic to any medicine or substances?
Well, I get a severe rash when I access adhesive tape.
Any of your family members have any history of illness?
My paternal grandmother is having cataracts, and my maternal aunt has migraines.
Well, your physical examination reports show blood pressure 110/64, respiratory rate is 18, heart rate is 66, and temperature is 98.6. Lower extremities is warm to cool, proximal to distal. The dorsalis pedis artery pulse palpable bilateral. Posterior tibial artery pulse palpable bilateral. No edema observed. Varicosities are not observed. Right great toe, right second toe, right third toe, and right fourth toenail show erythema and scaling. Muscle strength is 5 out of 5 for all groups tested. Muscle tone is normal. Inspection and palpation of bones, joints, and muscles is unremarkable. You have developed tinea pedis, a fungal culture of skin from right toes. KOH test shows no visible microbes. I'm prescribing Lotrimin AF 1% cream to apply 4 times a day, and Griseofulvin 250 milligrams PO once in 8 hours for 4 weeks.